Hello viewers, this is Dr. Hiya Agarwal, fertility specialist at Neelkanth IVF, Jodhpur. Today we will be discussing about cancer and the female fertility. Any person for that matter, if gets diagnosed with the cancer, it is a scary diagnosis, it is a life-threatening diagnosis, and they lose all the hope. They are not even sure that whether how much time they have left. That is the first question a parent, if it is a child who has been diagnosed or a person who has been diagnosed, asks to the doctor. But with the advanced techniques and with the novel techniques, treatments available, now the cancer has not been such a life-threatening diagnosis. We have cures available, we have a lot of good remission therapy available with which the cancer patients can also have a good survival and can look for a future. So with this advent, their loss to their reproductive health because of the treatment, which either can be chemotherapy, radiotherapy or a surgical treatment, plays a big role on their mental health. Yes, they have survived the cancer, but what about the future? They want their own children, they want to have a perfectly happy married life, a good family life. What about those, especially with the persons who are diagnosed with the childhood cancers? They have been so small on that age, and to get diagnosed with the cancer, get the treatment for it, they have not thought about the fertility. But now they are here, they are good, they are healthy, but they want their babies, they cannot get it. So with the advent of very good cancer treatments, we have to now think about how to preserve the fertility of these individuals, which can look for a good future, a future which a normal person can have, and they will not have the psychological burden which comes with these treatments. So with this has come the new role of fertility preservation. With this era of IVF, we have now the facilities available for cryopreservation of the eggs and even the ovarian tissues. So with the advent of these novel technologies, we have treatment available for the women who are diagnosed with cancer to preserve their fertility before they go for the cancer treatment. What we can do is, but the women who have attained menarche or who are getting periods, we can stimulate their ovaries, form the eggs, and then take out those eggs and cryopreserve them for a long period of time. And once they have achieved remission of their cancer with the treatment, they can avail to these eggs and get pregnant with their own eggs with the IVF technique. Even if they have not attained menarche, the ovarian tissue can be cryopreserved in the bits of cortical strips, and thus when they get remission, then these ovarian tissue can be retransplanted into their bodies, and thus the follicles can be formed. There have been very successful cases of ovarian implantation as well as the use of egg cryopreservation, and successful babies have come out of these treatments. So we urge the woman or the parents of the female child, as to even the male child, to please look for a fertility preservation whenever they have ward or their any colleague who has been diagnosed with cancer and is looking for a future childbearing, because there are methods available for fertility preservation and there are very good remission treatments available for cancer. So with the future, we don't want any kind of a regret of not at least knowing that we have this option and we have not availed it. If you have any other query regarding the fertility preservation methods, or if you are suffering from infertility and you want to know about IVF, you can call the number given below or visit the center. Thank you.